Okay, welcome back, and thank you for joining me for today's webinar. My name is Dr. David Kunashko. I'm the Medical and Innovation Director here at Bioflex Laser Therapy in Ontario, Canada. Today's webinar, I'm actually introducing a new consumer and professional device called the Surge, and it's the world's first dual wavelength, so red and near infrared, photobiomodulation or red light therapy cupping device. And what makes this very unique is the combination of wavelengths and Bioflex protocols. So that's a long title, but I'm quite excited to launch this new product and talk to you a little bit about cupping and the combination of cupping and red light therapy and how that might be a benefit to those of you listening in. As usual, this webinar is recorded and edited, and then we upload it to our website. So you can find this on bioflexlaser.com or bioflexwave.com, usually within a couple of weeks of the date of broadcast. Should you want to watch a webinar but cannot join that particular day, still register, and typically we send out an email that has a link to watch the webinar at your convenience within a week or so of the original date of broadcast. If you have any questions as we go along, please do ask them in the chat box, and I will definitely have time to get to those questions at the end of today's webinar. So I'm going to talk a little bit about therapeutic cupping. Some of you may be aware of this. I think a lot of you have heard about it, may or may not have it done to you, or perhaps you use this in your practice already. I'm going to go over some of the research out there on therapeutic dry cupping and a review of what red light therapy is, or photobiomodulation therapy, and why the combination of the two makes a lot of sense, and why this new device that we're launching, I think, will have really great therapeutic benefits. And then, of course, I'll introduce our Bioflex Wave Surge device and talk a little bit about its features and functionality. I will be having a follow-up sort of not so much a webinar, but an actual video on how to use the device, and that will be on our website as well. But today is more of an introduction to this device. And as usual, I'll have time for a Q&A at the end. Again, if you have any questions, just ask them in the chat box. If you could do that, I'd appreciate that. Okay, so you may recognize this individual. Well, in fact, you can probably read his name, Michael Phelps. He's quite a well-known swimmer. He has the most number of Olympic medals in the history of the Olympics. And back in the day, around 2014 or so, he was one of the first athletes that was starting to show up with these big, large, round bruises, or ecchymosis is the medical term for that, or hematomas. So a lot of people were interested, like, what's going on there, and really he was the first athlete, and because he was high profile, to bring dry cupping into the realm of the Western world, you might say. Of course, it is quite common in other countries, but not so much in North America and Europe and Australia and so forth. So really the popularity of dry cupping revolved around Michael Phelps and his obsession with this treatment. He was actually introduced to dry cupping by a strength and conditioning coach, and I mentioned this was back in 2014. He still swears by the practice, and back in the day when he was actively swimming competitively, he was receiving treatments at least twice a week, and he always made sure he did this before a race. So of course, that got a lot of people interested in, more athletes looking into this type of therapy. And certainly at the Paris Olympics, there are a lot of athletes that you could visibly see that they are also having cupping. And then, of course, other media outlets picked up on it, articles like, for example, in Vogue. And then, of course, your high profile media folks, people that were sort of, A-listers and movie stars and so forth, everyone from Jennifer Aniston to Hailey Bieber and so forth, Gwyneth Paltrow. They were all being photographed, and you could see these markings. So clearly, therapeutic cupping was reaching a sort of a therapeutic level amongst the public as well too. So cupping is a therapy or a therapeutic technique, you might say, that uses obviously a vacuum force, and it's traditionally in some kind of vessel or a cup, and obviously it's applied to the skin surface. The whole idea with this is functionally it can increase blood circulation, which potentially can reduce muscle tension and spasms and help promote tissue repair through improved blood flow. Most people that have this type of therapy mention that it helps with their pain, perhaps disability. We're talking about like different conditions like muscle strain or arthritis or what have you, and also increased range of motion. These are part of the reasons why athletes tend to use this type of therapy as well. LeBron James is another famous athlete in the NBA that has a lot of cupping. You can see marks on his back as well too. So going back in time, cupping therapy has been around a long time. It really dates back thousands and thousands of years. It was practiced as many things that were initiated in Egyptian culture and Macedonians. This is well over 5,000 years ago, and eventually evolved into other areas like China and in Greece. And there are many documentations of this type of therapeutic cupping. And over time, it kind of just gradually spread to other cultures. So there's two types of cupping, and I'm not sure if many of you are aware that you've listened into my webinars before. I'm also was trained in traditional Chinese medicine and acupuncture now over 30 years ago. And part of my training was in cupping, both dry and wet cupping. And although I didn't use a lot of it in practice, the dry cupping, just because as a chiropractor, I was tending to use more acupuncture. But it's a type of therapy that is trained, and a lot of courses are done in this type of treatment. Now, these two techniques are a little bit different. When we talk about wet cupping, this is actually where you actually break the skin. This might be, sometimes using what's called a star needle, and you tap the skin to create little abrasions or little tiny lacerations in the skin. Of course, you start to bleed, and then the cup is placed over that, and that's called wet cupping. Now, I'm not necessarily talking about that today, and the research I'm going to present really isn't talking about wet cupping, but that is definitely one procedure that some TCM practitioners or traditional Chinese medical practitioners might use in their practice. I'm more talking about dry cupping, and this is where there's no involvement of skin lesions or abrasions or bleeding when you apply the cup over the skin. And looking back now, since around 1999, cupping has been accepted as an official therapeutic practice in Chinese hospitals, very popular in Korea. There were some studies and surveys showing that a very high percentage of traditional Chinese or traditional Asian practitioners were using cupping in their practice, not just in Korea, but China and other, especially Asian countries. Usually cupping is applied over specific sort of areas of the body. This might be your back, your chest, your shoulder, abdomen, your glutes, the legs. So a lot of different areas that you can use it. Usually it's on larger areas, but it can be on smaller areas as well too. And now there's different ways of doing this. If you've had cupping before, usually it's not just one cup, it's multiple cups, maybe 4, 6, or 10. And then they are suctioned out in different ways. Sometimes it's using a flame, sometimes it's using mechanical air pressure. And these new devices like ours, the Surge, it actually has a built-in electronic pump that allows you to very easily apply that to the tissue. And they're left in place anywhere from 5 or 20 minutes. Now, there are some techniques that go along with this as well. Let me just back up a bit there. The after effects, so after you have cupping, typically you see redness over the area. It was called erythema, maybe a bit of swelling because the tissue's been pulled up. And eventually, oftentimes you get bruising or ecchymosis, and it's in that circular sort of arrangement because the cup tends to be circular in fashion. So the longer that cup and the more suction on that tissue, then you tend to get a higher degree of bruising. Now, these bruises obviously do hang in there for a while. Don't be alarmed with that. And certainly before you do any type of therapeutic intervention. Now, this is for people at home. For practitioners, obviously, you're a professional and you know when to use these types of devices. You do need to make sure that this type of device is right for you. These bruises may last quite a few days or several weeks. And it's interesting that when you think about the combination of adding red light therapy to cupping, then we know that red light therapy can actually reduce the time of bruisings. That is, it can help to heal those bruises faster. So that would be one advantage, and I'll talk about those as we go along. How you use the cup, as I mentioned, if there's static cupping, basically you leave it on one spot for a few minutes, 5, 10, 15, 20 minutes. There's variable rates of time that you can do that. Then there's something called running cupping, where typically this is used with an oil, and I'm going to talk about therapeutic oils as well, where you apply the cup, you apply sort of a therapeutic oil to allow to move the cup over the tissue, over the fascial area. And so you sort of suction up the skin and you move it along. This can be a little, how should we say, feel good pain, depending on how much pressure there is in the cup. But it is certainly a technique that's often used to help to reduce fascial adhesions in the area. There's something called flash cupping as well, where you quickly release the suction and then bring it back on again over one static area. So sort of on and off kind of thing. So there are other techniques, but those are the main techniques. The flash cupping especially has helped to sort of loosen up fascial tightness and muscles and help stimulate blood flow and help to resolve pain in that area as well. I'm not going to go over this in depth right now. I do have a paper that talks a little bit about some of the potential mechanisms of action of dry cupping. Let's talk a little bit about research. Now, there is some research, and well, of course, there's not a robust amount of research. Certainly, I would say there's enough that's been published to show that there is some efficacy shown in different clinical trials. And certainly when you talk about its utilization by athletes and patients alike, they're not doing it for fun. Yeah, of course, it might be a placebo effect, but I think a lot of people do feel better after having cupping, especially for muscular related issues. So I think it makes a lot of sense if you are suffering from, muscle strains or achiness, especially tension around the shoulders and the back, that kind of thing can be very effective as well. This particular paper was a meta-analysis and systematic review. So they looked at a bunch of published papers. In this case, it was 21 randomized controlled trials, just over 1,000 participants. And what they found here was that the quality of evidence was fair, which is okay, and low quality evidence revealed that dry cupping had a significant effect on pain reduction in both chronic neck and back pain. There was moderate quality evidence to suggest that dry cupping improved functional status of chronic neck pain. And there was some other research that showed more of a lower quality evidence that improved range of motion when compared to placebo. So overall, this particular paper found that dry cupping was found to be effective in reducing pain in patients with chronic neck and non-specific low back pain. However, they do talk about having more studies, more research into it, and understanding a little bit more about perhaps the mechanisms of action. Another paper, this was published in a journal called, and the title of it was called Meta Perspective of Cupping Therapy, the Effects and Mechanisms of Action. So they looked, basically what they did was they researched and looked to see what the possibilities of how this type of therapy worked. So looked at different research and reviews. In this case, it was 64. Then they came up with 6 theories potentially explaining the benefits of cupping therapy. One type of sort of mechanism is the pain gate theory. Now, this is a very standard type of mechanical way that you can help reduce pain. You think about it, it's like everything from sometimes massage or mechanical types of therapies, different types of things that can actually stimulate mechanoreceptors and pain receptors and temporarily block pain. So that's a pretty well-known type of theory. There's also something called diffuse noxious inhibitory controls and reflex zone theory. Muscle relaxation, changes in local structures, and increase in blood circulation might be explained by something called a nitric oxide theory because they have measured an increase in nitric oxide post-dry cupping. Nitric oxide is a really important molecule in the body, and when it's released into the blood, it actually causes temporary vasodilation. And in fact, red light therapy or photobiomodulation is known to release nitric oxide as well. Then they also looked at immunological effects of dry cupping and found that it seems to stimulate different components of white blood cells and stem cells in the blood as well. Then there was another theory called blood detoxification theory. Now, these are kind of Western theories. I'm not really getting into the traditional Chinese medicine of ways of looking at this. That's a whole other kind of branch. But they were actually kind of similar. They just talked about it a little bit differently. So blood detoxification, this may have more to do with the fact that when you're drawing out the blood, not so much for wet cupping, but when you're breaking up small capillaries and that blood is going into the tissues, it can perhaps have a sort of a detoxification aspect to it. So a lot of these theories kind of sort of overlap, and they're interchangeable. And there's really no one theory that explains all of the effects of cupping. In fact, there's probably quite a few that sort of, are responsible for that. And end result is they still need to really look at all the different aspects. It is a kind of mechanical treatment, but it will definitely have an effect on blood flow. And when you affect the blood flow, of course, you can have positive therapeutic effects. This is kind of the slide I showed earlier that's talked a bit about these potential mechanisms from pain reduction, affecting the immune system, affecting the blood itself, and having anti-inflammatory and effects on the blood circulation via nitric oxide. So all of these are potential ways that dry cupping can be helpful. Certainly there needs to be more research for sure, but I think there's enough out there that's been published to show that there is efficacy for using dry cupping, especially for certain types of conditions. And of course, given the times that we live in, we always need some Canadian content. So this particular paper was published out of Thunder Bay at Lakehead University, and they looked at the immediate effects of dry cupping on the lumbar paraspinal. So those are your lumbar back muscles, range of motion, and temperature. And so essentially they looked at 30 subjects, 18 to 30 years of age. They did dry cupping on the lumbar paraspinal muscles. They also did it on the leg muscles as well for 10 minutes. I'll show you sort of a picture of what it looks like. You can see here the lower back. You can see 1, 2, 3, 4. That's oftentimes how it's done for the lumbar paraspinals. And the positioning there. Now they used a plastic cup and they evacuated it with a specific device to do that. And what they found result-wise was that there was an improvement of pain. There was an improvement of range of motion in the lower back, and they measured this in these subjects. They also found a change in skin temperature as well. So overall, they felt that dry cupping was an effective strategy to increase lumbar spine range of motion, decrease stiffness, promote recovery, and reduce functional limitations. And they felt that there should be more ongoing research, obviously. This next paper, published in the International Journal of Sports Physical Therapy, was looking at the combination of static and dynamic myofascial drying cupping to improve local and regional symptoms in individuals with low back pain. Now, this was a case series. It's not as strong, you might say, research as a randomized control trial, a larger trial. This is, 3 or 4 individuals that they looked at to see if cupping made a difference. So it was 3 adults. They all had chronic low back pain, and they did static cupping on the lower back, as well as on the legs, and then they assessed these patients. They used a Oswestry Disability Index. They did objective measurements like straight leg raise measurements, and they did something called pressure pain threshold, which is basically using a device that pushes into the tissue and to see how much pain there is. Obviously, if it's helping, you can apply more pressure with as opposed to less pressure because it's painful, right? Okay, so these are the results. You can see pre and post. The first one is with respect to the lower back, pre 60.6, and then post. Now, this amount of pressure that could be applied to the muscles. You can see that in each of the individuals, they could apply more pressure after the therapy. And then these other ones similarly show the same type of results, meaning that there was less pain after treatment. Those last two are for the leg muscles. And here, this was the Oswestry Disability Index. The higher the score, the worse you are. So you want the Oswestry Index to go down. And you can see in each participant that this disability index went down after the intervention. Similarly, straight leg range of motions, that is when you're lying on your back and bringing your leg straight up, also increased post-treatment as well for all these three individuals. So these were encouraging results, obviously not a huge trial, but again, just showing you that, when it's going to back up a bit there, just showing you that dry cupping, there's definitely research that supports the use of it. Those of you who are new to red light therapy or photobiomodulation therapy have done lots of webinars on this, and there's tons of research to show the different effects. Essentially, the light's absorbed into the tissues, and it helps to increase the metabolism of the cell, to repair tissues. It can help reduce inflammation and pain, improve vasodilation and circulation, reduce swelling, and it helps to modulate collagen secretion, especially with repair of tissues that are injured. The thing about light therapy is that it works differently. It works inside the cell. It's not so much a mechanical effect like dry cupping. So directly, if cells absorb light of the certain wavelengths, you'll have this effect. That's called a direct effect. And when light goes deeper into tissues, it will have a direct effect into muscle tissues, for example. Whereas if the light is absorbed by blood, it can activate white blood cells and stem cells, and this is called more of a systemic or remote effect. And then, of course, wherever that blood circulates, especially deeper into tissues, it can help have a healing effect. So there's two ways that light therapy is helpful, both directly on tissues that are injured, right? Or indirectly or remotely through its effect on the blood. So you think about the combination of drawing the skin and the tissue up to a source of light. Now you have increased blood flow where the light can get into the blood, right? And have an indirect effect, systemic effect. And that light, if it's near infrared, which what we've done in this device, can go deeper into the tissues and have a direct effect on the subcutaneous tissues as well. So combining all of this, you can see that you'd have great effects. And overall, if you look at red light therapy or photobiomodulation, again, it can help to improve blood flow, have an effect on collagen, help with muscle regeneration and muscle atrophy. Again, I just want to remind you, I've been having difficulties with accessing the question box. So if you could just type in your questions into the chat box, I'll definitely get to those. And as mentioned, it can have an effect on inflammation, edema, and tissue repair, everything from nerves, cartilage, and bone as well. So why would you want to combine these two? I think now you can kind of see why, right? Is that dry cupping and red light therapy, or PBMT, have therapeutic effects that obviously can help make you feel better, reduce pain, help you heal and recover faster. These two therapies do work differently. So in fact, they can be synergistic. When you think about trying to recover from an injury or work on ongoing issues, you don't want to just do one thing, right? You're going to combine exercises. You might do different types of therapy, whether it's massage or manipulation or acupuncture. There's a whole host of things that you probably should be doing to overcome your injury, your ongoing chronic issue. So by adding or combining treatments, you oftentimes have synergistically a better effect. So red light therapy, we know from lots of research and even our own research here at Bioflex, that actually accelerates the healing of hematomas or bruises. So the fact that you're actually, getting this light onto that area post bruise as well would make sense that it should accelerate the hematoma. We're hoping to do some clinical trials on this as well too, so stay tuned for a little bit more information on that as well. So dry cupping can increase local circulation, thereby increasing the systemic effects of red light therapy by increasing the amount of blood exposed to light. Red light therapy can also have a deeper effect, right? So that infrared will have a deeper effect into the muscles and joints. I'm definitely going to be going over time, folks, just so you know. I haven't even gotten to the device yet, and here we go. So this is what the Surge looks like. There are maybe some similar devices out there, but this is definitely very unique. I'm going to talk about all of its advantages as we go along. So this particular device is an electronic-based cupping device. This is kind of what it looks like when you unbox it. There are three types of therapeutic cups. They're from large, medium, and small. And you can see the smallest one is kind of curved. That's to get over the sort of bumpy, lumpy areas like your ankle or certain areas of your shoulder where you can't make good contact with the larger circumference of the larger cups. It is a rechargeable device. It comes with obviously a manual, and I'll be doing a webinar on how to use the device specifically that will be posted on the website within the next week or so. You can see here are the three cups. They also come with a foam insert to make good connection with the actual main controller unit. Essentially, it just screws in. Okay. The wavelengths that we use here are red, 660 nanometers, and near infrared at 850 nanometers. There's three fairly high-powered LEDs. These are bicolor LEDs emitting these two wavelengths. The suction is minus 60 kilopascals. This device really has a powerful suction to it, and there's different modes as well. So I'm going to go over that with you as well. The irradiance is quite high at 30 milliwatts per centimeter squared. When the tissue is drawn up, the tissue actually is adjacent to the LED and touches the skin. So you really do get a good amount of light entering the tissue as opposed to exposing it from a distance, which is usually not ideal. So here are the features. You can see at the bottom right is the power and then the intensity of light. I'm going to talk about that in a second. There's a battery indicator, right? Makes sense. There's a release or pause. So if you want to release and take the device off, or you want to do that different types of techniques to draw it on and off, for example, you can use that release and pause button. Pressure will give you different variations of how much pressure is being drawn to the device, and then the duration, the specific treatment times at 10, 15, and 20 minutes. So the modes of mild pressure, when you push it just once, this is the initial mode to kind of get used to using the device. It has a fair amount of suction powers. For some people, that might be all they really need or are comfortable with. But if you want a little bit more or a lot more suction and drawing out, that would be the second level of deeper pressure. This will definitely increase the intensity. And those of you who are just starting out, again, this is not meant to be an actual how to use the device webinar. I will be doing that. That will be posted on the website. But you do need to ease into it, especially if you're not used to cupping, because it is it can be quite an intense experience. And so you need to judge and gauge how you react to it. And then, of course, there's that power button, but that power button also controls the light intensity. Okay, so there's low light, medium light, and high light. Okay, and now these aren't just sort of any kinds of light coming out. These are very specific to our proprietary protocols that we've used in our professional devices. At low level, it's a pulse rate of 50 hertz per or pulses per second at 50% duty cycle. In the medium, it's 100 hertz, so a lot more flashing going on, and that's at 80% duty cycle. And then if you want the most amount of dosage, we're now pulsing at 250 hertz at 90% duty cycle. These particular pulse rates and duty cycle combinations are ones that we routinely use in our professional devices. That's what make this That's what makes this device so unique out there, is that number one, it has the two wavelengths, or the dual wavelength. Near infrared is really important to go deeper, but also it has a proprietary pulse rates and duty cycles that we know are very effective for absorption and having a strong photobiomodulation effect. So here you can sort of see it's just on the tissue, and as it's on, it draws the tissue up towards the light, and it creates that suction. Instructions are relatively straightforward. And again, this is from the manual. Essentially, you're going to make sure your device is clean. You're going to clean it beforehand, and then you're going to screw in your device with the foam filter. And then, of course, you're going to hold the power button on. Now, again, you may choose to use a therapeutic oil. I'm going to talk about that very shortly. You'll toggle the duration, 10, 15, or 20 minutes is a duration cycle. And then toggle the pressure button, that is from -1 to -2. Default's -1, so the very start or beginner kind of pressure. And then you're going to toggle on if you want light. There's also a thermal effect as well with that light. Not so much the light itself, but the device creates a bit of a thermal effect. And then you can choose which protocol you want to use. And then you're going to position over the area and then start the treatment. And again, if you want to release it, you can hit the release or pause button. And then you're going to remove it and wash it with just basic soapy water and allow it to dry appropriately. It's not dishwasher safe, so beware of that. And there's lots of different warnings and precautions. I'll get into that into the next webinar. But one thing is that you do not want to take a bath or sauna for 2 hours after the treatment. And in part, that's because you already created increased circulation in the area and essentially a little bit of tissue trauma. So you need to let that calm down or settle down before you heat up the area to any great degree. There are different oils that oftentimes are used with cupping, especially when you're trying to move the cup along the tissue. This is oftentimes a carrier oil along with an essential oil. And these may help to enhance circulation, enhance or increase lymphatic drainage and digestion, relieve pain and inflammation, assist with the detoxification process, and help relax muscles. So we're actually testing a series of carrier oils and combination made for us specifically to use with the Surge device. It's undergoing testing right now, and they'll be released in the next month or so. And those are things that you can use along with this device as well. If you're interested in the device, just go to Bioflex Wave. I do know there's an introductory special on that where you buy one, get one 50% off, or buy two and get one free. And that's again on our website at bioflexwave.com. Some other events that we have upcoming is we have a next webinar, which is on about treating post-concussion syndrome. This is more of a healthcare professional webinar, but anyone can tune in. I will be in Vancouver for a Let Up Your Practice Introduction to Photobiomodulation at the end of March, as well as a advanced training on post-concussion therapy. That's on March 30th. On March 29th is the Let Up Your Practice in Vancouver. Again, if you're interested in this, just go to our website, bioflexlaser.com, and look for events, and you'll find them there. Thank you very much for listening in today, and let me get to your questions. Okay, let's see here. I have a question here. For disabled persons who can only use supine position and must apply alone, is it possible to try the cups if you apply it? So I believe what you're asking is, can you do it? So this device, you can apply yourself to certain areas. Some areas might be a little challenging, but even the lower back, you should be able to, depending on your reach, you should be able to apply them to your lower back. Now, some techniques you might have difficulty doing on your lower back, like if you want to move it along, that kind of thing. But certainly most other areas around your shoulder, or the base of your neck, or the legs, it's pretty easy to apply. So hopefully that answers your question. A question here. Someone comments about having a massage and had some nerve twitching or nerve pain. could you expect a similar reaction if you were using cupping? Well, cupping is definitely different than massage, right? The cupping is acting more on the subcutaneous and the skin and the fascial tissue, not so much directly into the muscle tissue and deeper into where the nerves are. So it's hard to say. I couldn't really answer that question, but there are different therapies. You might want to just try some cupping and maybe experiment with that with a practitioner first and see how if that's a little bit easier on your body. How long does the pain benefits last, or the increase of range of motion last? Is it cumulative? Is the use of professional laser work better and or faster? Okay, I mean, that's a great question. Again, my point goes back to combining therapies is usually better than just one therapy. This type of technique with cupping, for example, is more of a mechanical and improving circulation. The effects are cumulative, right? So yeah, it's going to relieve pain, but the whole purpose of it is to help the tissues respond and reduce pain over a long term. When you're combining with light therapy, remember this has a different effect directly on the cells itself. So really what you're doing is you're combining two different therapies, not necessarily saying that, oh, and I never advocate just laser therapy. If you watch my webinars, you'll see that I talk about other types of treatments that you should be doing alongside of that. This is just another type of technique or therapy that you can try, especially if you're suffering from chronically tight muscles or, other issues that it makes sense to try to use it along with. Will it stay in place when in use? For example, if I placed it on, yeah, so the suction keeps it in place. I guarantee you that. You don't want to be, mowing your lawn as you're doing it. But when it starts to create the suction, it's not moving anywhere. Is 30 milliwatts per centimeter square only available on the high setting? That's the maximum 30 milliwatts. So then you can do your math as to it ranges up to a max of 30 milliwatts per centimeter squared. I believe that's your question. The device sounds well thought out and amazing. Thank you. Want to see the post-concussion seminar if I can attend. I'm hoping to record it and have it then on our website. So yes, that might be an option there. My husband reacted with nausea when he put it on right away after straining a muscle. This cupping seems to be effectively applied the red thoracic and spine areas, for example, not lumbar. Athena, I'm not quite sure I understand that question. You can email me on that one. Can it be used for jaw or joint pain? I do not recommend it to be used on the face. Some professionals use cupping on the face and over the TMJ. I would not recommend it in this case, especially by use at home. Does the light go beyond the cups? The light is aimed downwards onto the circular tissue that you're treating. So it will be different circumference or surface area depending on the size of the cup that's exposed to the light. I think that answers the question. All right, thanks so much. I do really appreciate you watching in today, and I hope to see you in the next webinar. Take care now.